This pandemic is pushing some healthcare workers to the brink. Tonight, a Bay Area nurse reveals the new challenges. 8 on Your Side's investigator Masa Saidi is joining us from our Tampa newsroom tonight. Masa, this nurse really is kind of giving us a look behind the curtain.
Yeah, that's right, Keith. We want to take everyone beyond just the numbers tonight. This nurse explains what it's like as a hospital is stretched to capacity.
I work for a large hospital system. We see critical patients all over, COVID and non-COVID.
We're not identifying where Bay Area nurse Colleen Fulch works. The palliative care specialist wants to be candid. She's seen a dramatic rise in the number of critical COVID-19 patients. We checked state records, and her hospital had 0 ICU beds available on Monday. As her facility gets maxed out, Fulch says some staff members are starting to get burned out.
Our ICUs and many of our floors have had to be converted into COVID rooms, which means that our regular critically sick patients, we've had to find spaces for those patients to go.
Based on what you're seeing on the ground, is this accelerating?
It's so hard to tell. This thing keeps moving, and I think that all of us are concerned about that, quote unquote, second wave that might hit in the winter months, because we're not anywhere near through the first wave yet.
What, if anything, do you need that you're not getting?
Fortunately, we seem to have enough personal protective equipment. I think generally in Florida, I think a lack of support. It's okay, you don't need to wear masks, or we advise it, but it's not mandated. That kind of thing is very frustrating to us.
So, of course, statewide, there is no mask mandate in place. And in fact, this didn't even come up in today's news conference. Governor DeSantis did argue there is some positive news about the pandemic.
You look at the syndromatic indicators in terms of ED visits, those have declined. So I anticipate that to continue.
So he's saying there's less people with COVID-like illnesses going to emergency rooms, and if that continues, that is a good sign. That is what this nurse is hoping for, Keith.
Masa, this nurse also has noticed that younger people are getting sicker, even some who don't have the underlying respiratory issues.
Yeah, and she was really surprised by that, Keith. She said if you're younger and if you're obese or if you have diabetes, she's noticed that people that catch this virus, they get sick and they stay sick for a long time.
Right. Masa Saidi live in our Tampa newsroom. Thank you for that. If you have something you would like Masa to investigate, you can call the 8 on Your Side helpline number, 1-800-338-0808.